prevention, as you said, is better than cure. And so many times people would invest in the cure. We even struggle when it comes to public health emergencies. When there's an emergency, you get money for the response. But when you look for money for preparedness, it's a struggle. So it's great that the ministry is showing this clear leadership of focus on prevention. And we know that when people are reminded, and a lot of advocacy and behavior change, communication is done, people can change. We saw in COVID, people changed, towards hand hygiene. And it was very clear. You could see the numbers of the diarrhea went down. But after that, we've all relaxed and forgotten. So people need to be reminded consistently. I think the themes of this are very important. I'm excited hearing about, the thinking behind an Usafi Day. And we've seen this work in other countries, Rwanda being an example in place where the president goes out and everybody goes out and there's follow-up. And you can see when you go to Kigali, you see. So there are things that can be done. And it just takes that ownership of the community to own the process, and that leadership, which I see we have, has a potential to change the environment, people to change the environment in their homesteads, the markets, and other public places, and people to not see um, dirt and things in the environment as normal, because I think that's the problem, that we come to normalize things that are not normal. So if we get to a point that if someone drops something down or throws a peel, everybody around will look at them and say, what are you doing? So I think we have great potential here. Water and sanitation, definitely very important. And charity starts at home. We hope we look at washing health facilities. And WHO has guidelines on that, because we talk of wash, we tell people about wash at home, and when they come to the health facility, they meet terrible conditions. So I think as part of this campaign, that we really include the issue of wash in health facilities, and there are guidelines and WHO resolutions on that. So WHO will continue to work with you on this. We are your secretariat to continue to provide technical support. Another important thing will be the monitoring and evaluation, to ensure that as we're doing these campaigns and as we're doing the advocacy, as we're doing the education, to actually able to monitor and to see what are the changes, how is this changing in the environment. So thank you very much, and again, congratulations. And